Hey there! Are you aware of the current pandemic we are facing with the infectious disease of HIV and AIDS? The disease has been around for years and has spread globally, but the public still seems to have a washed over idea of what exactly HIV and AIDS are. Well, over the past decade, major medical advancements have been made towards the fight to end HIV and AIDS. Global awareness has been raised, and grants have funded medical research into finding a cure for the disease. But yet, it still continues to be a global health crisis. And a matter of fact, in 2016, nearly 37 million people were living with the HIV virus. So, you might be wondering, what exactly is the HIV virus? The human immunodeficiency virus, which stands for HIV, is a virus that is spread through bodily fluids. So, sharing needles, receiving a blood transfusion with infected blood, as well as having sexual intercourse with an infected partner, are all ways for the disease to spread. So now that we know what HIV is, you might be wondering, why is it such a threat? Well, the virus harms the body by attacking the immune system, the body's main defense mechanism towards fighting off diseases and infections. Once infected, the immune system is put in a compromised state and is unable to fight off illnesses. The simplest of illnesses, such as pneumonia, can be life-threatening to those who are suffering from the HIV virus. If a person who is suffering from HIV does not seek treatment, it can then advance to a more severe phase of HIV called AIDS. AIDS stands for Acquired Immune Deficiency Syndrome. The last phase of the disease often results in a fatal outcome. There is currently no known cure for the illness, and the infection is a lifelong battle. However, with early detection and the use of antiretroviral therapy, also commonly referred to as ART, the illness can be controlled and can allow the person to live a longer, productive life. With these medical advancements, people with HIV are living almost as long as those who are uninfected. But in order to stop the spread of HIV and how to protect oneself, there are some things you should know. First of all, people who are receiving treatment for HIV are still infectious. They are not cured. The cocktail of drugs an infected individual takes simply prolongs their lives and improves the quality of life that they are receiving. The medication prevents the illness from advancing into the more severe phase of AIDS. They can still transmit the disease, and it must use contraceptives when having sexual intercourse to prevent the spread of HIV. Secondly, the disease is spread globally, not only within developing nations. This misconception that HIV and AIDS is only in poor and developing nations has portrayed a negative connotation and a stereotype with the disease. In fact, in 2016, nearly 1.1 million people were living with HIV alone in the US. Although gay and bisexual individuals are more prone to becoming infected with HIV, everyone and anyone is at risk. Even infants who are breastfeeding from their mother, drinking contaminated milk from a mother who is HIV positive, can become infected. Everyone is vulnerable to contracting HIV. With proper preventative measures, one can protect themselves from becoming infected. So thirdly, how do you protect yourself against HIV and AIDS? Most importantly, use condoms when having sexual intercourse. The virus is spread when bodily fluids such as semen and blood come in contact with mucous openings, which can be found in the mouth, rectum, and vagina. So by having a physical barrier, the risk of HIV transmission is decreased. Besides practicing abstinence, couples can partake in sexual activities that do not involve bodily fluids to reduce the chance of receiving the HIV infection. Limit your number of sexual partners and have them tested before becoming intimate. There are no physical tells that a person is infected with the HIV virus, so it is important to get tested for the virus so it is not interspread amongst the population. People cannot rely on symptoms alone that they are developed the HIV virus. General symptoms of HIV vary from person to person, and in the early stages of the infection, symptoms are mistaken as the common flu. So get tested and have your partner tested for the disease. And avoid the use of using contaminated or pre-used surgical equipment. The inner use of dirty needles is one of the easiest and fastest ways for the spread of the disease. And lastly, talk about it. Talk to health officials and raise awareness within your community about this preventable lifelong illness. So hopefully and collectively, one day, we can rid this horrid